Group 1, like I've mentioned earlier, the one that stayed 9 weeks, we'll see that the stiffness decreased, and for group 12 the stiffness decreased even more, which stayed for 12 weeks, the second group. Effect of immobilization on tendons and ligaments mechanical. This is structure, this is a mistake. During immobilization, the cross-sectional area of the anterior collateral ligament is reduced. And you can see that basically even happens to muscle when a person puts his hand in the cast for a long time and he removes the cast. He finds his hands are thinner because the cross-sectional area of the fibers of the muscle fibers and the fibrils of the ligaments and the tendons, they are reduced. This is because the loss of collagen fibers as well as loss of glycans from the ground substance of the ligaments. In addition, there may be alterations in the collagen fibers orientation that reduce the properties and the efficiencies of the ligaments and the tendons. After immobilization, it appears that the mechanical properties of the ligaments are gained faster than the structural properties. So the person or the rabbit, like he measured in the experiment, they started moving before even their hands or legs started to gain their normal size. Effect of exercise on tendons and ligaments. What does exercise do if we have effect? Does it have a positive effect or a negative effect on tendons and ligaments, or does it not have any effect at all? As I mentioned earlier, they always use animals because it's hard to do these experiments with big things. They used animals, a cattle of animals, I think it was pigs, and they made them run on a track at a speed of from 6 to 8 kilometers per hour for an average of 40 kilometers per week for 3 months and 12 months. So there were two groups. The first group was for 3 months and the second group was for 12 months. And this is what they found. The short-term group, which ran for 3 months, showed no significant changes in mechanical properties for the tendons. However, the group of the 12 months showed an increase in the cross-sectional area of the tendons as well as a 20% rise in the tensile strength for the long-term group. In this graph, we're going to see exercise versus immobilization. Which one of them has larger effect on the tendons and ligaments? If we look at this graph, we'll find that for immobilization, the decrease in stress, the decrease in stiffness is much more rapid than the improvement that exercise gives. So in this very short period, we find that the decrease in stiffness is very high. If we compare it to exercise, over this long period, the increase in stiffness was very low. And we can see from here the recovery. Mechanical effects on healing of tendons and ligaments. In this experiment, they used the flexor tendons of skeletal mature dogs. What they did is they ruptured the ligaments and then they were repaired. And there were 3 experimental groups. The first group, complete immobilization. The second group, delayed mobilization. The third group, early passive motion. They found in this study that the early passive motion, as expected before, it increased the rate and the mechanical properties of healing. Because what passive motion does, it prevents the adhesion of the siege protective tendons to the tendons that are responsible for connecting the bones to the muscle. As I said, the results indicated that the tendons' strength and motion increased more quickly for the early passive motion group than for the other 2 groups. And these are the references.